Welcome back. As has become the custom here on Thursdays, we're joined by Dr. Timothy Quinn. He practices family medicine out of Ridgeland. Dr. Quinn, today we're going to talk about when it is time to see a specialist. First of all, why do doctors refer people to a specialist in the first place?
Well, basically, I was talking about a little earlier about a patient that actually got angry with me. He was being referred to a cardiologist, and he wanted to know, was I getting paid or something? And basically what had happened was his son had came 6 months prior, was a college athlete having some chest pain and shortness of breath on the field. We did evaluation, EKG, and we referred him to a cardiologist to make sure he was safe. The EKG was abnormal, and the history was very troubling.
Yeah.
Well, 6 months later, the patient's wife made him come see me. He didn't want to come. And basically, he was having chest pain, and when he would lie flat in the bed, he couldn't breathe, so he had to sleep propped up on pillows. And when I did the physical exam, he had swelling in his legs, very significant, and he had an abnormal EKG and elevated blood pressure. So I said, look, we need to refer you to the cardiologist. And he just got very angry with me.
Do you think you're getting some sort of kickback on this?
Well, that's what he asked me. He said, how much are they paying you, doc? You sent my son there. I had to pay extra copay. I was inconvenienced. And now you want to send me as well? He said, I don't have all this money and time. Well, the deal is he did go see the cardiologist. I had to get his wife to help me beat him up and make him go.
Yeah.
But they did an echocardiogram, which is a test to tell how hard your heart is pumping to push the blood. It was very low, like 35% ejection fraction. And they did a cardiac cath. He had very significant cardiovascular coronary artery disease. They actually had to do surgery, a triple bypass heart surgery, and they told him had he have not come, he probably would have lost his life.
Now, some people are going to say, you're a family medical doctor. How come you just can't help me? Why can't you solve everything?
Right. Well, the cardiologists, you got to think about it. They go to school extra long, specifically studying the heart. I mean, they do an extra 4 years after residency, so they're experts. But in addition to that, they have equipment that we don't have access to, like the echocardiogram that the patient had, or the cardiac cath. We just don't have that access nor that expert experience. So what we do as a primary care physician is get you with the specialist when you need to go, so that it's ensured that you're safe.
That happened to me not too long ago with a toenail problem. I've been to the doctor 3 times for that. They couldn't figure it out. Had to go to a podiatrist on your recommendation. I got to say, I'm walking around great now.
Yeah. Well, the deal is, what you have to realize is a primary care physician, a family doctor, a pediatrician, or a internal medicine doctor, we're like general practitioners. We know a little bit about everything, but we know a lot about when it's time to be referred so that the patients can get the best care. And that's what's really important, is making sure that everybody is safe and we can preserve people's lives.
That is it. So if you're referred to a specialist by your doctor, go ahead and go. He knows what he's talking about.
Yeah, because the thing is, like the patient we talked about, his son turned out to be okay. He just had musculoskeletal problems, and he had poor conditioning. He turned out to be okay, but he was safe. But for the dad, had he have not gone, he could have very well lost his life.
Absolutely. Triple bypass surgery.
Yes, very serious.
All righty. Thank you so much, Dr. Timothy Quinn. Thanks for spending some time with us. If you have medical questions to us, please send them to us at news@WJTV.com. We'll see about getting Dr. Quinn to answer those for you.
Will do.